When I was about 1 year old, I lost all of my motor coordination and was rushed to the hospital. To this day, my medical history has been with me and has helped me become who I am. Andrea Rizzo, age 15. Andrea never forgot the miracle of her life. Her recovery from childhood cancer helped to shape her studies and build her dreams. It introduced her to dance, which brought joy, balance, and confidence to her healing, and she vowed one day to take dance as therapy back to the hospital that had saved her life. After receiving her degree in education with an emphasis on teaching children with special needs, she was attending graduate school at NYU in hopes of becoming a dance therapist. That's when her life was cut short. But her dream lives on. Dréas Dream was to bring dance to children in need. The Andrea Rizzo Foundation was conceived out of that dream.
That was the beginning, and I haven't stopped since.
Susan Rizzo Vincent, Dréas' mother, president and founder of the nonprofit corporation, fostered Dréas' dream into reality.
Certainly the biggest accomplishment of the Andrea Rizzo Foundation is to have created, for the first time at Memorial Sloan Kettering, a pediatric dance therapy program.
The Creative Movement and Dance Therapy program provides the benefits of dance therapy to pediatric and young adult in- and outpatient populations.
The diagnosis of cancer in a child is extraordinarily traumatic, both for the child and the family. They are removed from everything they know in their normal life, and the most profound issue is that the child loses control of a body that they're just beginning to know.
It's really how a child becomes aware of their body and uses their body to express their feelings that is at the core and the heart of what it is that we're doing for these children.
With more than 20 years of experience designing wellness, preventative, and therapeutic mental health programs that incorporate movement and dance-based activities, Susie Totora, dancer, author, and doctor of early childhood education with an emphasis on infancy development, was the obvious choice to implement the program.
Andrea would be so honored to know that Susie is the one carrying out her dream.
We all know cancer is a very painful experience on many levels, on a physical level as well as an emotional level. And so being able to create a protocol to help alleviate some of that pain has been one of my goals at Memorial Sloan Kettering. Oftentimes when we have a group going on in the beautiful playroom, together we try on each other's feelings and moods and dance steps. Different children can add and contribute different feelings and moods that resonate with a child, but that child may not have known how to create that feeling or that sensation. Probably about 6 months into my work at Sloan Kettering, I was walking down the hall and hearing a child in very severe pain, and the nurse said, "Is there anything you can do to help us?" So I came in and I changed the lighting and I put on some music, and I began to breathe with this child and move very gently and rock this child. And I realized at that moment that I had the ability of helping stimulate the child's other senses rather than just the pain sensation. And so over the next couple of months, I started developing what I call a multisensory pain management protocol. What I try to do is get the child engaged and get her physically active so that her body is alive and strong. I also have her start to breathe. They keep track of the heart rate and the oxygen level to help monitor how much pain the child is having. Those measures are very stable while I work with the child.
I saw Susie working with this child, but also working with this mother who reminded me so much of myself, how she looked. The age of the baby looked about the same age as Andrea, and supporting this mother and leading her in such an intimate way that was going to help her baby. She was empowering that mother.
The most important relationship in that room is with the parents. And when the child is feeling pain, she'll get tremendous comfort if her mother is present and calm.
Oh, how I wished I had Susie there with me when Andrea was that age. This was a gift that the foundation is giving that I never even dreamed of.
When Susie walks into a room and begins to work with the child, an aura is created in that space, and it becomes a very sanctified space.
The whole room is transformed from a sick room into a well room. I've been in healthcare for over 20 years, and it's wonderful to be able to see people have less pain, less fatigue, less anxiety, more energy, and it's not done because of pills or because of an IV infusion, but it's done because of dance or movement. It's a very safe environment. It's an environment that the staff respect, and that's what I look to see with all of my integrative medicine services.
The Andrea Rizzo Memorial Foundation is growing in spirit and in deed. Support from dancers across America through benefit performances and dance-a-thons and annual fundraisers, including the Cliff Walkathon Dance Celebration and the Andrea Rizzo Foundation Golf Classic, are helping to bring dance therapy to more children each year.
We've brought dance therapy into the Ronald McDonald House for children who are being treated at Sloan Kettering and their siblings and their families.
And the Foundation's course is still firmly plotted on Dréas Dream.
She had already begun using dance with her special needs children, so by bringing dance therapy into public schools, we feel as though we're carrying out that part of her mission also.
Tragically, Andrea was never able to watch her dream unfold. In May 2002, with all of the enthusiasm of a healthy 24-year-old, she was inexplicably killed at the hands of a drunk driver. Why is the question that can never be answered.
It doesn't make sense that she should be taken from us in such a senseless way. But what does make sense is that her love of dance and her spirit live on in the dancing feet of the children at the hospital that saved her own life. And by reaching out in as many ways as we can to children with cancer and special needs, we feel as though we're really accomplishing all of Andrea's dreams.